North Carolina is part of a $26 billion agreement that will help bring desperately needed relief to communities impacted by opioids. Pitt County Public Health Director Wes Gray says the county has its own specific spending budget in this opioid settlement.
It's been in place at least 2 years now, and Pitt County gets a share of that big settlement. So right now we've got about $16 million, and that's going to be spread out in payments over the next 16 more years. It's an 18-year total project.
Pitt County has been launching multiple initiatives to help people struggling with addiction, along with getting people the right treatment needed to recover from opioid addiction, even if they're in Pitt County Detention Center.
The recovery court system, where basically if a person's recommended, they can complete a treatment program, and instead of going to jail or having a record, they can get that recovery side.
The settlement was launched in 2021 when opioid deaths were at their peak in Pitt County. Gray says they've worked on many plans since then.
Examples of plans include ECHM for Change. It's a syringe exchange harm reduction center here in Pitt County that receives some funding. Pitt Community College receives some funding for training. ECU received funding for a fellowship for addiction medicine.
The county's most recent opioid data is from 2022, when there were 55 deaths from overdoses, 46 out of which falling into the category called illicit, which means the opioids could have been laced with fentanyl or other drugs. ECU sophomore Oliver LeDuc knows all too well about a family member dying from a lace overdose.
No one hears from her from 24 hours. Cops show up at her apartment and find her OD'd in her own bathroom.
Pitt County's two main drug concerns are illicit fentanyl and synthetic opioids when they mix with other narcotics. And Gray says that's been the leading cause of overdose deaths recently.
But what we see now really is the drug supply that's been here is tainted with the illicit fentanyl and synthetic opioids. And that's what's driven really the overdose crisis in the last few years.
Fortunately, Gray says the number of deaths of people having overdoses in Pitt County has gone down. LeDuc says he just wants people to see change and be knowledgeable about the dangers of the drugs that are out there.
She was laced. That's what ultimately killed my aunt, and I just want people to know her story and just be a little bit more aware of what's going on.